Dr. Reed, you're on next.
Okay, well, hi everybody. But I'm going to tell you my biggest takeaway first, which is if you have questions, please email me. And I'm happy to kind of talk about anything specific with any of you anytime. I'm also happy to connect you with other students who are in health and aging now or who have done health and aging in the past. So don't hesitate to reach out. Okay, next slide. So this is just my sort of recognition and pitch that health social workers are essential workers. And, health social workers have had a lot of different names over the years. They've been called medical social workers, which I think is a fairly restrictive title, although that is still used and quite common. But I am hoping, and we'll talk about this in a few minutes, to have health social work be broad with some foundations and social determinants of health. But this is just highlighting that there's a huge demand for health social work, broadly speaking, and specific to health settings, medical settings. And it's anticipated to be a growing need. And indeed, there are many jobs for social workers right now out there, and many of those are in health settings. Next slide, please. So this is just a quick overview, and I actually have a flyer, but I'm not able to put it in the chat. Dr. Bayaki, just so you know that. I don't know if you can, but I have to, anyway, it wouldn't let me do it. I tried to do it. But this is just like a big overview of what we try to cover in the specialization. So we're really interested in looking at the relationships between overall psychosocial health and illness and the intersections with the healthcare system. And again, we're like, when I say healthcare system, that does mean like places where people are accessing some sort of healthcare, but most of sort of what makes us healthy are things in our home environment and our community. And so we do talk a lot about sort of community health in general as well. We learn to effectively advocate for and with vulnerable populations. So anytime any person is interacting with a health system, it is super complex. Probably all know that from your own experience. But it's a lot of different moving parts, and they're very hard to navigate when you're ill or have other things going on. Like I mentioned just a few minutes ago, I really try to ground everything we do in social determinants of health and equity. So that's sort of the basis that informs a lot of the conversations and the work that we're doing in class. We talk a lot about interprofessional education and interprofessional care teams and practice and what that looks like, and the challenges of communicating across professions and across disciplines. And that extends far beyond sort of doctors and nurses, but with police officers and chaplains and, other workers that we hear less about in the health system, and social workers' relationship with those. And I guess the last thing I have is communicate clearly and effectively with diverse audiences. So this is true for all social work, but particular to social workers in health settings. You're talking with a patient who is quite sick, and then you're talking, with a family member, and then you have to communicate something with a child, and then you're, talking with the doctor, and then you have to do a family meeting. And so there's all these different important pieces of communication that happen that require, a deep awareness of your audience, and also, attention to what you're writing down and what you're saying, and if they understand, awareness of health literacy. So these are just, some highlights of what we cover. Next slide. And this, I'll just want to emphasize, because I think every year there's lots of confusion that health, like this name of the specialization is health and aging, but it really should be health and or aging. So, we have, in the past and now, as students who focus just in pediatrics. Last year, there was a placement, an awesome placement at the Mind Institute at UC Davis that's working just with little ones and their families. So just to know that you can be exclusively working with pediatrics, working with kids, and do health and aging. And you might be working exclusively with older adults, and you can be in health and aging, and that's great. And most realistically, people are working across the lifespan. So, there's a lot of placements that work with adults, a range of ages, and then all, the families and stuff that come with them. So, adults are often caregivers for older adults or younger kids. And that's a lot of, what we're focusing on. So it's across the lifespan and not focused on needing just to be with older adults. Although if that's your passion and that's what you want to do, then you certainly can do that in health and aging as well. So this slide is just highlighting social determinants of health, which are sort of, the conditions where, you're born, how you grow up, where you live, where you work, and how you sort of age. And California has this new awesome initiative around sort of an aging plan for the state that again is across the lifespan, not just with older adults. But there are lots of conditions, environmental conditions that affect our health. And actually your access to healthcare has very, very little to do with how healthy you are. It really has everything to do with all these other factors. So we spend a lot of time learning about that and talking about that and trying to see where social work intersects with that and has, opportunities for change and, hopefully improvement of overall health in people's lives. And this is again from like a population health perspective, and a lot of our work is, individual based, but we have to understand the populations, of the communities around us to be able to be, focused on the right kind of interventions and engagement and assessment, all the kind of social work stuff that we do. This is, saying similar things, but sort of across disease trajectory. So looking at how living conditions there are in the middle. So those are all the social determinants of health that we're talking about. And then the connections with sort of social inequities, so sort of huge, big problems, and mortality sort of at the other end. So all these things are connected, and I think they can be hard to kind of wrap your head around, because a lot of times people think, well, my health really has everything to do with going to the doctor, which is connected to having insurance. And people think of transportation as well, if I can get to the doctor. So if I live in a rural area, as long as I have transportation to the doctor, that's what we're worried about with transportation. But really, we're worried about just transportation in general, nothing to do with having to go to the doctor. So we have to kind of extract ourselves from thinking about a big hospital or a health system somewhere. And it's really all these other factors of just sort of living your life that affect sort of your health. This is, we do a couple of different things with interprofessional education formally, and then we have other sort of opportunities where we have some, in-class activities and things like that. But we work with the UC Davis School of Nursing and have some joint education sessions where we talk about bioethics. A lot of it is case-based. We do some health narrative sort of discussions too, where we come together in small groups and sort of in big classes to try to problem solve together, working across professions, which for a lot of students is sort of a new experience, and is a range of feelings around that. So it's usually frustrating, which ends up being a good thing, because you're trying to figure out how do I explain what I do to somebody who either has a preconceived notion or idea of sort of what I do, or has no idea, or thinks they can do what I do better, or what do I do? So there are all these questions that come up for people, and sort of that I'm going to say force, but it's a gentle encouragement to figure out how to name what you do when you're new at doing it in a way that's compelling and important, and sort of carves out why social work matters. I think is a really helpful thing that is highlighted. I mean, we talk about that all the time, but is highlighted sort of in these interprofessional education opportunities. Next slide. These are different practice settings. So again, it's a huge range. I will just, I know the field office will talk about this, but don't be restricted by what's sort of listed as just being a health and aging placement. Dr. Bayaki sort of mentioned that there's a lot of opportunity in a lot of places that don't explicitly list health and aging, but that are excellent health and aging placement. So, please reach out about that, talk with the field office, talk with me, talk with current students, so we can make sure that your interests are sort of, that you can be learning at a place that, is interesting and fulfilling for you. So I've had a lot of students in macro placement. So I've had students at NASW California, there's students at DHS this year, somebody's at the California Health Department. So there's macro opportunities where, there's obvious clear intersections with health. And then the rest of these that are listed are very much micro placement. So case management, some of that's telephonic, some of that's in person, hospice and palliative care, both inpatient and outpatient. We have a lot of settings and specialty clinics, which can be a great opportunity. I've had students at YOLO housing and different housing placements in the, in the past too. So all of these, just think broad when you're thinking about relevant health placements. And I guess just to emphasize it, and not, I can't say it enough, to really think about, like, as you're picking your field site, just be open, but also go after what you want. And I know I talked with all the health and aging students this year, and they're all would be happy to talk to you about sort of their experiences and their placements to help you sort of find the place that's going to be the best fit for you. So please reach out to us. Next slide. And I'm not going to read this, but this is sort of just a kind of list that highlights the things that we're hoping, objectives of the specialization and things that we're trying to learn and focus on throughout the semester. The fall is very much on engagement and assessment, and the spring is on intervention and evaluation. And I think that's all I have. Yeah. Can I have a second for questions, or is it
Sure.
just
Yeah.
Does anybody have questions or things that they want to ask? No? Okay. Well, I look forward to hearing from you, and good luck deciding on your specialization.
Dr. Reed, do you think, I imagine this is probably one of the fastest growing subfields of social work. Do you imagine with, all this attention on social determinants of health, that there's going to be a lot of career options for folks who are interested in kind of how can I do social work in a healthcare setting?
Oh yeah, I mean, there's a lot of evidence that it's growing, and there's I think a market, and people are hiring. A lot of like academic medical centers, you do have to be licensed, which can be tricky. But there's a lot of places like FQA, federally qualified health centers, and other sort of health placements that hire students and provide supervision and support people in getting licensed. So yeah, but it's definitely, I think, a growing. I think Dr. Guayo might challenge me and Dr. Kenny on behavioral health, but I believe that the sort of health social work is sort of the wave of the future.
Awesome. Thank you, Dr. Reed. I know that Dr. Reed is great for reaching out to and talking to more questions. I know this is such a big setting. People may feel a little bit intimidated, but please feel free to reach out to Dr. Reed. There's a flyer she created as well. We will post that with all the slides today when we post it to Canvas. Awesome. Great. Well, I think next up is Dr. Nyland, who's going to talk to us a little bit about children and families.
Thank you, Dr. Biaki. So